driving through, it takes a lot more security to set up a LZ perimeter and maintain it for a certain amount of time.
After a safe landing zone has been located, the next step is to set it up for the helicopter, if you have the time and resources. The LZ may not always be adjacent to the scene. Alternate sites may be further from the scene or at a safe rendezvous site. Because some first responders use life flight on a regular basis, they have planned ahead and picked out several safe landing zones in their area.
You want to prepare for an LZ before you ever need one. So we have several pre-designated landing zones in Canby Fire District. Every now and then we'll add a new one to the list.
As the landing zone is being prepared, the ground crew is preparing the patient for air transport, as they would for ground transport.
To prepare a patient to go in the helicopter is pretty much like preparing to transfer a patient at the hospital. If you have multiple wires and life packs attached and IV bags and all that type of stuff, it has to kind of be condensed and ready to move. You don't want to be running around with IV bags up like this and disconnecting your monitor in the landing zone. You want to do all that stuff as early as possible.
The patient should be strapped or in full C-spine if possible. It's much easier to load because we just take the board and put it on the air stretcher and then go.
When the life flight helicopter comes into radio range, there are certain protocols the flight crew and ground crew will follow before it lands.
When life flight approaches a landing area, it's always a good idea for the landing zone officer to contact the helicopter and tell us that you have us in sight. Once we have a visual contact with you, we'll let you know. When we arrive at the scene, we're going to do an orbit overhead. And what we're doing during that turn over the accident area is we're looking for wires and any obstacles that we might potentially hit or on the way in or on the way out. And we're going to be asking the landing zone officer for some specific information about that LZ. And some of the items that we want to know are, do you have any wind down on the ground? I mean, how strong is it? And can you give us a general idea of where it's coming from? Also, are there any wires or trees?
After the flight crew determines the LZ is safe to land in and the aircraft is on final approach, radio communication between the flight crew and the ground should be limited to emergency transmissions only.
I think the less radio traffic, the better. Certainly as they're approaching. You don't want to be talking to them when they're approaching or they're taking off, unless it's an abort type of issue.
If the landing zone officer or anybody that's on the radio in the landing zone sees an obstacle or a hazard that they think is going to be a potential hazard to us and we're heading for it, please shout out. Tell us to abort the approach or wave us off. We'll come back and look at it again if we didn't see what it is that you're looking at.
When the helicopter touches the ground, you stay out of the LZ. Don't get distracted away from your duty as a landing zone officer. Pay attention, and to don't lose your focus. It can be easy to do, especially if you have a real serious scene.
Never approach the aircraft while it's running unless they have direct eye contact with one of the medical personnel. My biggest safety concern during a landing and in the LZ, I would have to say, is the tail rotor.
As the flight crew exits the helicopter and joins the first responders, they will quickly assess the patient and request information about the event.
Our concerns are in many ways going to parallel the first responders' concerns in terms of the ABCs.
When the flight crew gets in the back of the ambulance, flight crew gets report from the ground crew, and we determine if any advanced procedures need to be done, and usually doing a quick ABC assessment. We like to know the mechanism and if they have any major allergies or anything vital, about the situation that the physician would ask us, so we can relay that as well. It's great if they can hand us a little piece of paper that has all the little stuff that they've been writing down about the patient, name, birth date, that kind of thing, and maybe a quick set of vitals. It's not necessary, but it is nice to be able to just put that in your pocket and go, and it helps to expedite sometimes.
Once we get a sense of what's going on with the patient, we'll make sure that the patient's properly packaged up, and we'll just have a controlled movement of the patient towards the helicopter.
Remember, if you're wearing a helmet, to put your chin strap on and tighten it down.
Make sure that there's no baseball caps on. Just a mental note to please remove it before you get close to the rotor system. We also like to ask that people, if they don't need to be close to the aircraft, they stand outside the rotor disc.
After the flight crew and ground crews have exchanged information, it's now time to move the patient to the helicopter.
The key thing is safe and controlled and follow the directions of the flight crew. People should stay together. One of us will choose to stay with the patient and monitor the patient's transport to the helicopter. The other will go back to the helicopter a minute or two earlier than that, open the doors, make sure that the helicopter is prepared for the patient. And pretty much in as controlled a manner as possible, we're going to be sliding the backboard onto the pedestal. In the process, handing off the ambu bag if the patient's intubated, and making sure that IVs and the oxygen bottle are also managed. The oxygen bottle we're going to hand back off to the EMS crew so they can take that back there with them. And as the patient is loaded into the aircraft, no one is kind of wandering off, especially back towards the tail rotor, which is a huge concern for us.
There's no hanging around. I mean, as soon as they don't need us anymore, we're out of the landing zone and out of the hazard area. So it's pretty quick once you're in there.
Well, at that point, it's pretty much the flight crew's job to buckle the patient in, move the patient back into the aircraft, close the doors, and then we're done. I'd like people to stay together, and as they leave, walk away from the aircraft, they basically retrace the path that they took heading back to the scene.
Life flight crews are active 24/7. Landing a helicopter is normally an easy and uneventful process, but darkness can present some challenges to the LZ commander and flight crew.
Night landings bring some special considerations for us.
Darkness always adds an element of safety that you have to think about.
Anytime they're landing at night, I think you need to be extra careful because there may be obstructions that you don't see. Power lines, that's when it's important to know your area.
Coming into a landing zone, an LZ at night, can be more hazardous than during the day. Obstacles aren't as visible.
We do a high reconnaissance when we arrive at the area. We have some special lights on the aircraft. When we circle the area, we're looking for those wires and trees and whatever else we can spot. Wires are very hard to see.
And you got the wires.
The flight nurse generally talks to the landing zone personnel, and they'll ask for additional information.
We're just carrying the wires.
We don't like to see headlights pointed directly towards the landing zone. That can hurt the pilot's vision.
During the approach, people for some reason want to shine their lights at the helicopter. And when that bright light hits that, it does a couple of things. First, the light diffracts on the windshield. You can't even see through the window. And it's very possible the pilot will lose his night vision. So we ask that you don't shine any lights at the aircraft at all. So lights are a huge consideration.
Although night vision goggles will assist in the safe landing of the helicopter, all standard precautions should be followed.
Well, life flight makes a difference because of time. Life flight can shave so many minutes off a transport that it has nothing to do with how good the ground medics are. It has to do with time and getting them to surgery. Or, say, a cardiac patient, if you can make that hour transport or that 50-minute transport into 15 minutes, you're doing that patient a world of good.
I see Life Flight as just another tool that we can use that definitely helps with patient care.
We pride ourselves in making a difference for that person that needs us badly.
The things that Life Flight brings are speed and quality of care. And for patients that need those two things in particular, we deliver.
I feel like Life Flight makes a difference in the rapid transport that we provide, as well as the advanced critical care aspects that we bring to the field for the patients.